All right, this morning we are talking about lung cancer and COPD Awareness Month, which we are in right now. We have Dr. Matthew Karolf with us from UP Health System. Thank you so much for coming in.
Well, thanks for having me here to talk about these important topics.
We were just mentioning you were here last year. You had just moved to the Upper Peninsula. So before we get into this, you've been here now over a year. How is everything going?
Wonderful. We love it up here. It's as everyone knows, it's gorgeous up here, but the community is fantastic. Everyone's been so welcoming, and even though we're enjoying a nice fall-ish weather for a few days, we're looking forward to the snow.
Yeah. I think we're all kind of starting to get the itch, so I can relate to that. So, all right, let's talk about lung cancer and COPD Awareness Month, because obviously these are two really important diseases that are important to highlight and keep in the forefront of our minds. But why these two, and why is it for you important to spread these messages?
Sure. Well, again, I appreciate the opportunity to talk about these with you today. This is Lung Cancer and COPD Awareness Month, and they are distinct diseases, but as a lung specialist, we talk to people about them all the time. They individually can have significant impacts on people's health, their quality of life, their financial health. It can impact their families, their communities, their friends. Together, they share a lot of similarities. They have very similar risk factors, smoking most notably, and they share other factors that are similar, such as both can develop with little to no symptoms. And so having good care with your primary doctor is important to talk about these and to potentially get screened, which we'll talk about, which has been a really exciting development in the last decade for lung cancer specifically.
Yeah.
But
and let's talk about the lung screening, because, you know, like you said, it can develop without any symptoms. So how does someone know when they should go get a screening? When is it appropriate?
So for both, just having an awareness, which your doctor will do for you as part of your usual health maintenance conversations. For lung cancer specifically, we've known that when symptoms develop from lung cancer, usually it's pretty advanced. And we all know kind of conceptually that the earlier you diagnose something, the easier it is to treat. Lung cancer is no exception. So within the last decade, there's been a growing body of data that shows that a lung cancer screening program for folks who are at high risk indeed detects cancer earlier and saves lives. It's, in fact, it's the most successful screening program out there. With when it's used appropriately, it can have a 20% reduction in your risk of dying from lung cancer. And on top of that, it saves it detects other diseases and lowers all-cause mortality.
How does the screening actually work? What kind of screening is it?
So again, it starts with a conversation with your doctor, and there's a shared decision-making where you decide if it's right for you, because everything in life, but particularly in medicine, has risks associated. So you have to understand what those risks are. But your doctor will identify if you're a high-risk patient, and basically the current guidelines are if you're between the ages of 50 to 80, if you've got a 20-pack year history of smoking, which 1 pack per day for a year is 1 pack. So if you smoke a pack a day on average for 20 years, you qualify. If you smoke 2 packs a day for 10 years, you qualify. But between the ages of 50 to 80 with a 20-pack year history, and currently, if you are a current smoker or if you've stopped smoking within the last 15 years, you qualify. There's ongoing conversation. In fact, the American Cancer Society just released this month an update to those guidelines, getting rid of that quit requirement. And so basically, if you ever had a 20-pack year history, they're suggesting that you can get screened until you're 80.
So the best thing to do is just start that conversation with your doctor and go from there.
And so once they identify that you qualify and you agree that you want to do this, then basically you go in, you get a low-dose CT scan of your chest. It's a low radiation test that a trained radiologist will review and score the risks of what they find on there. One of the challenges with lung screening is that finding abnormalities in the lungs is pretty common. And so it's not just a test that you get, you have to have a test, and then there's an interpretation. What do we do now? Is it just follow up over time, get another scan in 3, 6, 12 months?
Yeah.
Or do you need to do something more like a biopsy or a specialized radiology test?
All right, well, Dr. Carroll, I want to thank you so much for coming in this morning. Such great information, always so much information. And bottom line is, if you feel you need to have that conversation with your doctor and get things started. And I appreciate you coming in this morning.
You're welcome.